Good Wednesday morning, and today we are answering a question from a listener, and here's the question that they asked. Dr. John, how can a Christian doctor care well for a transgender patient who wants hormone replacement therapy? Where is the line? What is the duty in this scenario? Is referring the patient out to a provider who is willing to prescribe HRT even a viable option?
I sympathize with anybody who's having to deal with this area at the moment because it's so easy to get into deep trouble. So I'm glad I'm not in your shoes. That's not really a very nice answer for you, but let's try. I think the first thing that you've got to discipline yourself into doing in all these situations is, how do I deal with this by asking questions? You really got to say no statements, only questions. Then you can answer their question. I suggest that many doctors need to escape from this because they're not going to be able to handle it. They're not, in fact, the appropriate person to do it. But you can begin by talking with a patient about what the patient wants from you. And you have to say to them, look, this is a very complex area you're moving into. It's new. We're still in a steep learning curve. And I know that you are driven by very sincerely held and deep feelings. So question number one I have to ask you is, have you come here for me to affirm you in what you have decided, or have you come here to ask me what I understand about this condition? And if they say feelings, they say, well, I'm a busy physician and I've got people on my tail all the while. I don't have time to deal with feelings because that's not my bailiwick. You need a counselor for that. So you need a counselor in these issues who can give you an hour or two several times while you make up your mind thoroughly about what you actually feel and what your feelings mean. I'm too expensive for that. So most physicians, we're an expensive commodity. We can't spend the hours that are needed. This is not going to be a short procedure, is the first thing to say. And if they choose the feeling route, then you have politely to say, well, I'm sorry, I can't just refer you to someone else because they also will need to get through this. You need to do this the right way, and you're talking about how you feel. So talk to people who specialize in that first and get them to help you to express your desires in a way that will fit with what we do and what we can do. Now you can also say to them, I know you can find doctors who simply give you the drugs you want. But I can't do that because I think there are aspects of those drugs that you need to understand, because you could come back to me later and accuse me of malpractice for doing that. So you've got to show them what they're asking you to do, what that could do to your life. It is malpractice, I've no doubt whatsoever, and there's going to be a lot of litigation. I mean, the cases are already accumulating of people who are trying to reverse, but of course you can't if you've gone all the way. And other people are manipulating it for nefarious ends, like they brought down the SNP, the Scottish National Party, because they foolishly ended up sending a nasty rapist who said, I'm going to say that I'm a woman and they have to send me to a woman's prison, and they did. That didn't go down well. They were beaten in the election completely. So what's going on here is very complex psychologically. You need a good psychologist before you get to a doctor who's going to do any practicalities. And I suspect that before long, we will see a lot of change. First of all, the Tavistock Clinic in London, the lead transgender organisation in the UK has been closed for incompetence. That what they were doing has been declared by a government report. No, you've got to stop this. That's not a small change. Then, of course, the problems that come along with this are increasing all the while, and more people who've gone through the process are saying, I wish I hadn't done it, but it's irreversible. Jordan Peterson had a long interview with a young woman who's had her life wrecked because she got turned into a man, and now she's a woman who can't have children and can't breastfeed. So I hope that helps a bit. Tincture of time is what we used to call it when you met a procedure that you have great worries about. And then a little time passes. I never used the newest drug on the market outside my own area of expertise. I always wanted to bat a little lower down the order when we'd seen what was going to happen. Most drugs and most treatments, they come in and they're the best thing since sliced bread, big upstroke. Then you start to get the problems, huge downstroke, a patient dies as this chronic problem or the other. And eventually they find a niche where they have some use, in many cases, but not all. So that initial up and down, which happens with virtually every drug, I want it out of the way before I impose it on anybody, unless there was a life and death issue where it might make a difference. We should be essentially small c conservative in therapy terms, I think. Unless you're a researcher and you're doing new things. I've done new things in my career, absolutely new firsts, but they didn't come out of the moment, on the spur of the moment. They were the result of years of work.
Hopefully you guys found this helpful, and if you guys have any questions for Dr. John, you can ask them as well at www.johnpatrick.ca/ask, or you can find it in the links below the description. Thank you all, and we'll see you next week.